patient is admitted to a hospital. They are sick but not dying. Within hours, their condition collapses without explanation. The medical team responds, but the damage is done. No one questions the nurse standing at the bedside, because that nurse is supposed to be there. This is the mechanism Charles Cullen used for 16 years. Cullen was a registered nurse, trained, licensed, and employed across 9 hospitals in New Jersey and Pennsylvania between 1988 and 2003. He had access to patients in their most vulnerable moments. He had access to medication dispensing systems, and he had access to something more corrosive than any drug he ever administered: the institutional trust that follows a man in scrubs through a hospital corridor without question. His method was consistent. He would obtain medications, most often digoxin, a heart drug that becomes lethal in overdose, or insulin, through the automated dispensing systems used by hospitals. He would pull medications for patients who hadn't been prescribed them. He would administer those drugs without authorization. And then he would watch. The deaths looked natural. Elderly patients, chronically ill patients, patients already on complex medication regimens, their bodies absorbing a fatal dose of the wrong drug, their charts offering no immediate explanation. Hospitals filed reports with state regulators. Some triggered investigations, most did not. What is particularly devastating about the Cullen case is not simply what he did, it is what the institutions around him chose not to see. He was fired or forced to resign from multiple hospitals. Background checks were conducted, references were given, and each time, Cullen moved to a new facility and continued. A 1992 investigation at Warren Hospital in New Jersey was quietly dropped. St. Barnabas Medical Center flagged unusual medication access patterns in 1993. The findings did not follow him to his next employer. By the time Somerset Medical Center in Somerville, New Jersey began its own internal review in late 2003, at least 2 patients had already died under Cullen's care there, Reverend Florian Gall and Jin Kyung Han among them. Cullen was arrested on December 12, 2003. He was 43 years old. In custody, he cooperated with investigators in a manner that was almost clinical. He provided details of killings across multiple states, across more than a decade. He ultimately pleaded guilty to 13 counts of murder and 1 count of attempted murder in New Jersey, and to 11 additional counts of murder in Pennsylvania. He was sentenced to 18 consecutive life terms. But Cullen himself has stated the total number of victims may be closer to 40. Some investigators believe it could be higher. Many of those deaths will never be confirmed, because the bodies were cremated, because the records are incomplete, because no one was looking closely enough at the time. The Cullen case exposed a systemic failure that extended far beyond one man. Hospital administrators who prioritized liability over transparency. A medical regulatory environment that allowed a nurse with a documented history of suspicious conduct to obtain fresh employment with minimal friction. Automated drug dispensing systems with inadequate audit oversight. Following his conviction, New Jersey passed legislation requiring hospitals to report certain information to a central registry when terminating employees for cause. It became known informally as the Cullen Law. Pennsylvania followed with similar reforms. Charles Cullen is currently incarcerated at New Jersey State Prison in Trenton. He will not be eligible for parole. The patients he killed had names: Reverend Florian Gall, Jin Kyung Han, Christopher Pessa, Ottomar Schramm. They came to hospitals for care. They were placed in the hands of a system that failed them long before Cullen ever entered their rooms.